So we're going to talk about type 2 diabetes today, and what type 2 diabetes is the body can't process insulin properly. And just some random facts about type 2 diabetes. It's more prone for obese people, and it could be caused by many factors like smoking, unhealthy diet, and living a sedentary life. Some changes you can make: you can lose weight, and it could reduce your risk of developing type 2 diabetes. Get active, which coincides with losing weight. Have a good diet, which goes with getting active and losing weight, and avoiding tobacco products, which could raise your blood pressure and all that stuff. And some symptoms, just a couple symptoms of type 2 diabetes is like you'll have thirst, blurry vision, you'll have numbness in the hands and your feet, you'll be irritable, you have cloudy urine. And
if you're wondering how long you should work out each week, there are specific guidelines that you should follow as an adult. It's 150 minutes of moderate activity or 75 minutes of vigorous activity. You can kind of alternate between those two. You can do like 10-minute intervals each day throughout the day, and you should also have 2 days of strength training added into that.
So today we're going to do a couple of fitness activities that are going to be helpful for you for your everyday life, starting with a simple squat. So to start off, we're going to keep our feet about shoulder width apart, pointing straight forward. When you're doing your squat, make sure you put your weight back into the heels of your feet, as well as keeping your chest up so you're not completely collapsing over and falling, as well as to get a complete squat, we're going to keep our legs parallel with the ground, just as shown. And up. So that's a simple squat. A couple modifications for a squat would be to keep your toes and your knees going outward, and that's going to reduce some stress on the knees if you have any injuries or anything like that. So the same thing, you're going to be a little bit wider than shoulder width, and you're going to squat out again. And up. Another exercise is going to be step-ups. So you're going to basically step up and have your other opposite leg swinging through, as well as going the same way, going both ways. This can be done on normal stairs, on a chair, a couch, basically any stable surface that you're getting at elevation to push up and get some workout in your life. A simple exercise would be jumping jacks. So you have your classic jumping jack where you're moving up and out, and then there's also jumping jack modifications that are simply, it's a step out and back, and then you switch like step out and back. So today we're going to do a couple of push-up modifications that are easily done, especially if you don't have enough strength to do full body push-ups. So we'll start off with on your knees. So what you're going to do is kind of have your arms still shoulder width apart, knees together, crossed feet, and you kind of walk yourself out so that you're still keeping a flat surface, and push down and up again. It's really important to make sure that your chest touches the ground so that you're getting your full muscles worked during the push-up. We're also going to go over, it's called a Superman push-up. So you're going to start on the ground, your arms and legs are going to come out. Again, you're going to come down to shoulder width apart, using your feet to help push you up and back down. Other ways to stay healthy and stay in shape are to do simple things like going for a walk with your dog, or walk with your friends, walk in the park, or if you're sitting down watching TV during your commercial breaks, get up and walk around your living room, walk around your house, go up and down the stairs until your show comes back on, just to say, hey, those couple minutes that you were working out during and watching TV. It's called commercial cardio.